All right, hi everyone. Welcome to 28 Sport Show, that program where we talk to teenagers, we discuss everything that concerns teenagers about their life, issues, and today we are looking at the health of a teenager. My name is Oma, your very sweetheart on radio, TV, and social media. And I have with me an amazing person. I'll let him introduce himself by himself. He's already smiling.
Because you called me an amazing person, my ear started to swell. Oh, I'm amazing. All right, I'm Dr. Gbenga Adebayo. I'm the CEO of Living Health International, a health solutions and consulting company. We're based in Lagos, but we do things here and there, both locally and internationally. And it's my honor and pleasure to be here today.
All right, so how long have you been a doctor? Like, how long have you been practicing?
Oh, well, I graduated from Obafemi Awolowo University, Ileife, in 2004. Right?
Wow.
That's a long time.
A long time ago.
Yeah,
amazing. And if you see Dr. Wenga, he looks so young that you didn't even know he graduated in 2004.
So that's 20 years, really? That's true. I've left school 20 years. Honestly. You're not making me feel old.
And a lot of persons to be honest with you, people that are listening to you right now are very young people. Okay. They've not been born as at the time you graduated.
No, you are now making me feel like a grandpa. I'm a grandpa.
You're not a grandpa, but it's amazing how you have so remained relevant and even more relevant. Speaking of what we are discussing today, right? The health of teenagers, right? Now we've been on this training for 5 days. Okay, HIV training from journalists and media practitioners, and from all that I heard on this training, that a lot of young people, adolescents, teenagers are not even aware of the risk of HIV, right? So I'd like you, as an authority in this area, please, can you talk to teenagers, what is HIV?
Okay. All right, thank you for that. Well, I also, interestingly enough, now that you say, I'm also a parent to 2 teenagers.
Oh, wow.
My first child is 17.
Wow.
My second child is 14, going to 15.
Okay.
And then I have a baby in the house. So that's a lot. That's another story to tell some other day. So what's HIV? HIV simply is a virus, a disease that is caused by, the name of the virus is human immunodeficiency virus. Okay. So it's a disease that you catch or that you contract, depends on how you want to put it. And on itself, it's not something so serious. Yeah. But the virus attacks the immune system of the body. Okay. Your immune system is what makes you to catch anything and fight it.
All right. Okay, let's...
Like the soldiers of the body.
Okay.
Okay, you want to say something?
I wanted to ask, for example, when someone gets this virus, it weakens the body system, right? Such that anything that comes your way, you get it. Like if it's malaria, you get it. If it's typhoid, you get it. Whatever. Is that?
No. Our body has an immune system, right? And this immune system is composed of 2 parts. Okay. We have some cells, that are dedicated cells in the body that fight things that should not be in the body. Okay. There are also some cells now that now produce substances that help you fight, so that we call those substances antibodies. Yeah. They help you fight things that when you have been exposed to them before, your body now says, I know you are not to be here. And so those things fight them. Right. So what HIV does now is that it attacks the cells that fight things that the body does not know. It attacks them, destroys them. But it doesn't do this attack and destruction just overnight. Okay. It takes a while. It takes years. 5 years, often up to 10 years. Oh, wow. So when the body these body's defenses are now totally depleted and destroyed, something that normally will happen to someone and the person will not have any effect on the person. These things we call them opportunistic infections. Okay. Just like, some people will not steal. But when they see that your window is open, that's when they will take your phone. Yeah. It's when you open your gate. They will not go out of their way to steal. Yeah. If you keep your bag and you leave it somewhere, that's when they will take it. You leave your phone. So these opportunistic infections now overwhelm the body. Even some things that normally are in the body, some germs, because we have more germ cells in our body than human cells. We have more germs, more bacteria, fungi, and all those other things. We have a lot of them, and they are normally there. They serve a function of protecting us from more dangerous things. But what HIV does is that it now destroys our immunity so seriously that these things that are normally there, they now sweep a person. So the person has a small cold, the person goes over. The person starts to have skin cancers. The person starts to have diarrhea, just starts to stool,
And these things can actually happen anybody, any teenager.
Anybody. Once you have HIV, and the HIV is not treated, it's not managed, it will now progress to AIDS. So HIV is not necessarily AIDS. AIDS is acquired immunodeficiency syndrome. It's an acronym, AIDS. Acquired, that means you are not born with it. It happens over time. Immunodeficiency, your immune system is so syndrome. So that means it's not just one thing, different things. And so that's what makes HIV a terrifying disease, that your body in its essence cannot defend itself. Right? But now we know that what the HIV is not just a clinical disease. What makes us really not what the part of the great challenge about this disease is the social dimension
to it.
of
But
the
before
disease.
we come to that, I'd like to ask, what are the modes of transmission?
And I was going to link that to the modes
Please
of
go ahead.
to what I was going to say, because why is it a social disease? You know, like when we were in this room now, we're asking we asked you, how many of you have had typhoid before? And everybody just literally
raised their hands.
Typhoid, I had typhoid. And they were not ashamed. Meanwhile, for you to have typhoid, you need to eat feces. You need to eat feces. And people are not ashamed, because people don't really blame you if something like that. But the mode of transmission of HIV is such that the chief mode of transmission is sexual. So there now becomes some form of morality attached to it, that it is only people, so to speak, that are wayward and are immoral that catch HIV.
But that's not what it is.
And that's not true. There are a lot of people, even though the mode of transmission is sexual, it is not they that did the sexual exchange. It's just maybe their spouses, their partners. And in Nigeria now, and that's why we are happy to be talking to teenagers, there are a lot of teenagers living with HIV that were born with it. That were born with it, that their moms had the disease, they didn't know they had the disease, they gave birth to them, and they moved or because they didn't know they had the disease, precautions that could have been taken. Because you can have somebody that is a positive mother giving birth to
a negative,
right? And that's what some of the people in this room that we spoke with, the head of the female network of people living in HIV. That's like she has 3 children and they're all negative. So that you have a positive. So the chief mode of transmission is sexual. But any other thing that leads to exchange of body fluids, right? That leads to blood, can also get the disease to be transmitted.
What can a teenager do to ensure that, apart from, of course, the sexual part, what other things? Because you've said any other thing that could lead to exchange of bodily fluids. You know, sometimes some teenagers, they are not really aware of this information. What can they do to ensure that they protect themselves?
Is to first get knowledge. And that's what we're here to do, is to trade in knowledge. Because if we know I say to people that if you know better, you live better, you live longer. So it's to just first be aware that HIV does not, you don't get HIV by talking to people, by hugging somebody, by shaking people, by having somebody with HIV. They are mimicking me. You don't get HIV through those means. So it's for you first to have knowledge, right? And then, of course, to now take that means of transmission, exchange of body fluids. People will inject drugs. People will inject drugs. People will, drug use, right? And exchange needles.
And we say no to that, right?
Yeah, we say no to drugs. But it's getting more common. People exchange. People want to feel high. They want to exchange in vices. All of us need to create enough avenue for people to know that. And then, of course, since we are speaking to teenagers, we may not talk about mother-to-child transmission because we don't want our teenagers, of course, to be mothers. So it's to get knowledge, have the confidence to say no. Because we've seen some people, they may say, I'm a virgin, and they practice sex, but not fully sex. They say, oh, we've not had vaginal intercourse, but we have done every other thing. You exchange body fluids, you do all those other things. You can beyond, and HIV is not the only sexually transmitted disease or infection in town. A few others, hepatitis B is there, herpes is there, HPV is there. So, getting knowledge and living a positive life. Violence.
Some people are raped.
Yeah, sexual violence is something that is in our environment. It's real. And a lot of people, because of the shame and the stigma of saying that I was sexually assaulted, they run away. They don't keep quiet. If you have been assaulted, you can get help immediately. Because there are things that we need to do that if we don't do them within 72 hours, then we can't do anything anymore. Right? So if we need to get medicines to, even the person that assaulted that individual has HIV, there are medicines that you can use to help. There are interventions that can be done to prevent an unplanned pregnancy, a forced pregnancy. So that's why we say information is powerful. People should know what to do, how to control themselves, signals. Don't use drugs. Don't abuse alcohol. Because a lot of people, when they abuse alcohol as young people, their senses are not. They go to parties where alcohol is exchanged, things are exchanged, and then they lose control of themselves, and then they find themselves.
Now let's talk to teenagers that are already, because I'm well aware that there are teenagers that are living with HIV. Number one, they may not know they are living with HIV because their parents are in charge of this information. And number two, there are ones that could know about it, but because of the social stigma, what can they do to ensure that they come all out and live life freely?
Today we say that HIV is not a death sentence. Not in any way, not in any shape. The medicines and the drugs available right now, the technologies available right now, are such that you can live a full life. Right? And then we are talking now about U is equal to U, that undetectable is equal to untransmissible. That you get your medicines and you use them appropriately. We'll test your body for HIV, and we may not see the virus anymore because the virus is suppressed. Doesn't mean that you have been cured of HIV, but you can go ahead and live a normal life. But the key thing now here is that the person must use those medicines daily. Maybe a time will come that we may have medicines that you can use monthly, you can use quarterly, you can use things. Maybe we will get there. But for now, one tablet daily. And so,
the person is okay.
Person is fine. Person cannot transmit it to somebody else. Person can get married, live a normal life. Partner will be HIV negative. Children will be HIV negative, and the person lives a full and productive life.
All right, let's talk about stigma, because one of the things you said is that even children perpetrate stigma without their knowledge of it, probably because of what their parents told them. Before you see, they are discriminating against other children. Now, to a teenager who is HIV negative, how should he or she treat another teenager that is HIV positive? We need to know that these are human beings, and that a lot of those things, in fact, they didn't choose this, right? It just happened, and that they are human beings. There's a certain level of human dignity we should all accord ourselves. And a lot of the stigma that we have associated with persons living with HIV is based on ignorance. They think, oh, if you touch me, then I will catch it. If it smells me, I will catch it. No. And that stigma is what makes living with the disease even largely unbearable for a lot of other people. So we don't want to do that. We don't want to be the source of pain and misery for another human being. So we should love all people, love ourselves. And a lot of people that show
What I found out about a lot of bullies is that people are often bullies because they themselves are insecure.
Yeah, true. I agree with you.
They themselves do not appreciate who they are. They lack self-awareness, self-confidence in themselves, and then they take it out on other people. But we say no to that. Show love, show kindness, because you too may lead that love and kindness very soon in the future.
Yeah. So finally, what advice do you have for young people, teenagers, to live their lives? What advice do you have for them?
I just put something up, a quote earlier today, that we shouldn't make permanent decisions because of temporary problems. Okay. It's 30 years since I left secondary school now.
Wow.
And we are trying to do something for my school. At the time we went back to the school, I just remember that there is nothing I was worried about 35 years ago that is relevant now. Yeah, all those things that we were worried about, what is this, what will happen? Enjoy your youth. Make the best of relationships. Discover yourself and be the best that you can. That's all. I say to my kids, I don't want you to be the best. I'm not really interested in you being the best. What I want you to be is to be your best. If you do your best, if you propose to yourself that I'm going to be my best, and that's good enough for me. So don't get lost in what people say, in expectations, in trying to wear the latest clothes, the latest shoes, so that you can feel that you are among. You are not what you wear. You are not where you live. You are not even whatever people think you are. You are who you are. And as a young person, the world is full of limitless possibilities for you if you will just say no to what you should say no to now. I don't think any 18-year-old, 17-year-old, 15-year-old, it should be asking, who is my girlfriend? Who am I married? Anybody you're talking to now, you're just wasting your time. All those rubbish, you're just wasting your time. This is the time to do what is your job. Face your studies, be the best. Somebody say, no, I want to be a musician. This person did not go to school. That person did not go to school. You better get a good education. That education is a springboard for whatever it is that you want to do. Some people wonder, I'm a doctor, but some people don't even know me as a physician. They know me as a cinematographer.
Are you serious? That's good. That's like multi-talent.
They know me as someone that shoots and directs productions. They know me as someone that takes pictures. Some people, if I take a camera and I'm taking pictures somewhere, people say, photographer, I'll just smile. I'm a physician. I'm not just a physician, I'm a public health physician who has trained. But all those skills that I use, they are useful for me today.
Wow, thank you so much. This is amazing. Thank you so much, Dr. Gbenga Adebayo. I got the name right? From Living Health International. He has said it all. Be the best. This is the time for you to realize who you are and be the best of who God has created you to be. My name is Oma. You're very sweet out on radio, TV, and social media. See you again next time on 28 Spot. Bye-bye.
Awesome. Thank you.
You're welcome.